Namaste friends, welcome to Bano Biology Center for True Learning. Here I request you to subscribe our YouTube channel Bano Biology Center for more videos and press the bell icon for latest notifications and updates. In previous videos, we learned different contraceptive methods like natural or traditional methods, barrier methods, intrauterine devices and oral contraceptives. In this video, we make a small attempt to learn remaining contraceptive methods like injectables, implants, and surgical methods. First, we begin with injectables. What are injectables? Injections containing hormones, either estrogen or progesterone, or both, are given periodically to women to prevent pregnancy. Here, injections are given to the females who doesn't want to conceive. What injections contain? Injection mainly contain either only estrogen or only progesterone or contain both estrogen and progesterone. Here some examples are mentioned. One is depot-medroxyprogesterone acetate, shortly it is called DMPA. Second example is Node syndrome enanthate, shortly it is popularized as NET-EN. Other examples are Cyclofem, cycloprovera and mesogyna. These are the injections helpful in preventing the unwanted pregnancies. Here the picturization of injection is given. On the bottle of the injection, the chemical mentioned is Depo-Provera, which is contraceptive injection available in the dose of 150 milligrams. Let us learn a few points about depot-medroxyprogesterone acetate, shortly DMPA. Actually, this injection is the commonest type of injection used as contraceptive. It is available in the dose of 200 milligrams. This injection is given intramuscularly. Injection is injected inside the muscle. How many days once this injection need to given to the females? Once in 3 months. The female who want to avoid the pregnancy must take the quantity of 200 mg. It is marketed as Depo-Provera in India, like this Depo-Provera. The main functions of this injection is blocking the LH surge. LH means luteinizing hormone. During the discussion about menstrual cycle, we came across the word LH surge. What is LH surge? The presence of luteinizing hormone in the blood reaches its maximum level or peak level, which is referred to as luteinizing hormone surge. Here, LH surge is essential for the ovulation, releasing of secondary oocyte from the Graafian follicle. This injection stops that ovulation. Another function is make the cervical mucus thicken. Actually, cervical mucus is very thin. This injection makes that mucus thick. Thick mucus do not allow the sperms easily enter into the uterus. Another function is altering the endometrial receptivity for implantation. Here, for the implantation of blastocyst on the endometrium wall of the uterus is requiring the endometrial receptivity. When endometrial lining is in proper existence, the implantation takes place successfully. If any changes happens to the endometrial lining, the implantation of the blastocyst becomes very difficult. Another example, NET-EH, North testosterone enanthate. It is given in dose of 200 milligrams, which is also given intramuscularly every 2 months. Once in 2 months, female need to have the NET-EH. This injection also injected inside the muscle. Another example is Cyclofem. It is a monthly injection. The dose of injection is 25 milligrams. It is the combination of medroxyprogesterone acetate and 35 milligrams of estradiol cypionate. Cyclofem is a combination of 25 milligrams of depomedroxyprogesterone acetate and 35 milligrams of estradiol cypionate. Next, another contraceptive method is implants. What are implants? A small flexible tube, plastic tube, insert under the skin of female upper arm. Implants are intended to insert under the skin of a person exclusively in the upper arm. This is the picturization from which you can easily understand how the implants are appearing, where implants are inserted. These are 6 capsules. This constitutes the system called implant. These implants are inserted here 1, 2, 3, 4, 5, 6 in a fan-like structure. These implants are inserted under the skin. So let us know few things about the implants, how they helps in preventing the unwanted pregnancies. These capsules contain, these implants contain only synthetic progestin. This system contains 6 capsules 1, 2, 3, 4, 5, 6. The length of each capsule is 35 millimeter. Then the outer diameter of each capsule is 2.4 mm. Each capsule contains 36 milligrams of crystalline LNG. LNG means levonorgestrel. This is the chemical. Crystalline levonorgestrel is the chemical filled in the capsules in the 36 milligrams of quantity. So up to how many years this implant is effective? These implants are effective for up to 5 years. Up to 5 years from the date of insertion, they release the chemical into the blood, so which prevents the pregnancy. Here LNG released by the capsules is in varying quantities. In first 6 to 12 months, this chemical will released at the rate of 85 micrograms per day. In the next 9 months, the same chemical LNG will release at the rate of 50 micrograms per day. Afterwards, the 30 micrograms of LNG is released for remaining days. This is the rate of releasing of the LNG chemical inside the body of the person during the 5 years of time. Here example is Nexplanon. This is the picture, gives us the clarity about the implant. Nexplanon, this is the kit containing the 6 capsules. Let us see merits and demerits of the implants. Merits: rapidly reversible. When female want to remove the inserted implants, immediately she can come to the normal conditions and can try for the pregnancy or conception. That is called rapidly reversible. Then implants are highly effective. They can prevent the pregnancies effectively. There are no estrogenic side effects because of non presence of the estrogen. Because of absence of the estrogen, there are no side effects. It can be inserted 6 weeks after postpartum in lactating women. After the delivery of the baby, so women can get the implants inserted under her skin just after the time period of 6 weeks. That is called postpartum period. These are the merits. Come to the demerits. The first one is weight gain. The person may result in gain the weight. Another one is breast tenderness. Another one is require surgical procedure. For implanting the implants, the skin need to be open, means the surgical procedure need to be taken up. Another one is no protection. It cannot give protection against HIV and AIDS. Next, finally, so we look at the another contraceptive method which will be discussed under the permanent method of contraceptive methods called surgical methods. As the name indicates, to apply this method, the small surgery need to be done for both male and female. Right. Surgical methods also called sterilization method. Here, surgical methods are advisable for the male or female partner as a terminal method. Here, option is given to the couple. So either male or female partner can go for the surgical method, or both can go for the surgical method. What is the main intention behind surgical method? The main intention behind this is blockage of gamete transfer and thereby preventing the pregnancy. When gametes are unable to reach the needed places, the fusion cannot take place. By that, zygote formation won't take place, and there is no talk of implantation and developing of the fetus. Nothing will be happen. Here, surgical methods are two types. One is vasectomy, another one is tubectomy. What is vasectomy? Vasectomy is the surgical procedure done for males which involving bilateral vas ligation in males. Actually, if we remember the structure of male reproductive system, there are two vas differences. Long tubes arise from the caudal epididymis and reaches and combine with the duct of the seminal vesicle. They are called vas differences. Here, vast differences on both sides are cut and tied. That procedure is called vasectomy. Here, make a small cut on both the vast differences and simply tied up the cutted parts of the vast differences. It is used as permanent method of birth control. It means the vasectomy is not reversible. Once surgery is performed, so we cannot get back it. This can be performed at any point of time. Then sperms are prevented from reaching the seminal vesicle. When vas differences will cut, the sperms unable to reach the seminal vesicle. Then whatever the liquid released by the seminal vesicles, then prostate gland and bulbourethral glands, so reaches the penis, but that secretions do not contain the sperms. I mean, semen does not contain the sperms. So even that fluid ejaculated into the female vaginal tract, there is no problem of fertilization. The another surgical method performed for exclusively for female, tubectomy. What is tubectomy? Tubectomy is also surgical procedure, so which involves the cut or ligation of both the fallopian tubes. In this picture, it is very clear about the cutting of the fallopian tubes and tidying of the fallopian tubes. This is the one fallopian tube. This is the another fallopian tube. Here the fallopian tube cut here. Here also same thing is done. After cutting, the cut parts are easily tied up with the thread. Tubectomy results in permanent cessation of woman's ability to procreate. It blocks the entry of ova into the fallopian tube and there is pregnancy. Ovum released in the ovary, then actually it moves along the fallopian tube and reaches the isthmus region. Then sperms also reaches the isthmus region. The fertilization happens and zygote is formed. Then zygote slowly moves towards the uterus and implant in the endometrium wall. This is the actual procedure. So when tubectomy is performed, the released ovum in the ovary cannot reaches the uterus. Then there is no concept of fertilization. So when tubectomy can perform, it can be performed immediately after childbirth and up to 7 days. which this period is called mini lap, or 6 weeks after birth, which is called laparoscopic ligation, or after induced abortions. In three different type periods, the tubectomy can be performed. One is immediately after the childbirth, which is called mini lap. Another is 6 weeks after the birth, which is called laparoscopic ligation, or after induced abortion. If abortion is performed at the time, also tubectomy can be performed. So it is about the surgical methods of contraceptive methods. Till now, so we discussed 7 different contraceptives methods. Apart from these, there are some emergency contraceptives. In the emergency situations, some contraceptives are helps a lot. Actually, they are for treat unprotected sex, sexual assault, missed period, which have high risk of pregnancy. When persons participate in the sex without taking the caution and have sexual assault, and periods are missed, at that time getting the pregnancy so or more. Here some drugs are used to treat this treatment as morning after pills. The pills taken for treating the emergency situations called morning after pills. Some examples are given here. One is I pill, another one is pill 72, another one is unwanted 72. Here the diagram of I pill is given, and diagram of pill 72 is also given. These drugs are effective if used within 72 hours of coitus. When persons participated in the sexual intercourse, from that point of time up to the 70 hours, these tablets need to be taken. Then only they will work effectively. It is about emergency contraceptions. So apart from discussed contraceptive devices, some other devices also used by the females to avoid the unwanted pregnancies. They are like, one is skin patches, second one is vaginal rings, the third one is sponges. Actually, this diagram is explaining us the procedure of tubectomy, how the fallopian tubes are cut, ligated, and how the fallopian tubes are tied and surgery is performed. Thank you for watching this video.